So essentially, a beta blocker is a drug that binds to what is referred to as a beta and adrenoceptor, or pronunciation varies, adrenoceptor, thereby blocking the binding of norepinephrine and epinephrine to these receptors. The aforementioned inhibits the normal sympathetic effects that act through these receptors. Hence, essentially, beta blockers are symptomatic drugs. Some beta blockers, as they bind to beta adrenoceptors, they will partially activate the receptor, preventing norepinephrine from binding to. So essentially, it partially activates the receptor, preventing norepinephrine from binding to receptors. Some beta blockers possess what is referred to as a membrane stabilizing activity. This effect is like the membrane stabilizing activity of sodium channel blockers. Some of us might be aware, there are various classes of drugs that act to reduce or to reverse the effects of tachycardia. Apart from beta blockers, we have what we refer to as calcium channel blockers. We also have alpha blockers. Fortunately, today we will focus just on the beta blockers. Some beta blockers tend to bind to, or most beta blockers bind to, as I mentioned before, beta adrenoceptors, and these are located in what we refer to as the cardiac nodal tissue. Now, because this is a presentation almost in the form of a webinar, it does not allow for questions and answers. On another circumstances, we would have a minute or two to pause just to clarify any misunderstandings that the students might have. So as the beta blockers bind to the beta adrenoceptors located in the cardiac nodal tissue, which is a conducting system, there is the contraction of myocytes. The heart has both beta 1 and beta 2 adrenoceptors, although the predominant receptor type is the beta 1 adrenoceptor. So, as mentioned before, beta blockers are prescribed or used in the treatment of various conditions, among which are, I want to address two today, are hypertension, maybe three, angina, and myocardial infarction, which is commonly referred to as a heart attack. The beta blocker decreases what we refer to as the arterial blood pressure by reducing cardiac output. Many forms of hypertension are associated with an increase in blood volume and cardiac output. So by reducing the cardiac output by beta blockade, there's an effective treatment. It results in an effective treatment for hypertension, especially when used in conjunction with a diuretic or an ACE inhibitor or an angiotensin blocker. Regarding angina and myocardial infarction, the anginal effect of beta blockers are as a result of their cardiodepressant and hypotensive actions. By reducing heart rate, contractility, and arterial pressure, beta blockers technically reduce the work of the heart and the oxygen demand of the heart. By reducing the oxygen demand of the heart, there's an improved oxygen demand ratio, which can relieve patients of anginal pain that is caused by this reduction in oxygen supply demand ratio due to coronary artery disease. Myself have been prescribed a beta blocker in the past, can attest to the effectiveness of beta blockers in reducing symptoms such as tachycardia. There are different classes of beta blockers and specific types of drugs, which I will address towards the end of the presentation. But technically or typically, beta blockers are that are used clinically can be divided into two main classes. These are your selective beta blockers and your relatively selective beta blockers. Some beta blockers have additional mechanisms besides beta blockade that contribute to their unique pharmacological profile. Many of the side effects of beta blockers are related to the cardiac mechanisms and include, as I mentioned previously, bradycardia and hypotension. And it is this hypotensive effect that is one of the strengths of the beta blocker. Someone who's suffering from palpitations or tachycardia wants to reduce that that heart rate, that heartbeat, thereby allowing a sufficient supply of oxygen to the organs of the body. Beta blockers can mask, it should be noted, the tachycardia that serves as a warning sign for insulin-induced hypoglycemia. So individuals who are experiencing hypoglycemic symptoms will, if they are on a beta blocker, this can mask it, as mentioned previously, particularly in diabetic patients. Therefore, beta blockers should be used cautiously in diabetes. And to close, as I am now 7 minutes and 46 seconds over my 3 to 5 minutes allotted time, some common examples of beta blockers include propranolol, metoprolol, atenolol, labetalol, and carvedilol. So I want to thank you very much for your time today. I hope this sheds some light on what a beta blocker is. Essentially, it serves to reduce cardiac output. It prevents or it addresses tachycardia, and it allows for a better supply of oxygen in the body. Again, thank you very much for your time. I appreciate it and hope consideration will be given to my application. Have a great day.